So what is the house opinion? I can see few like Tapobrata, Paramita, Priya, and who all are there? Let me see the participants. Prashant is also there. So should I? Okay, then I'll repeat that. So I'll share my screen. So assumptions I have to tell today. So we'll start again. So I'll summarize the yesterday session. So yesterday we did, if you see, we learned about the survival analysis, and then we learned a new concept, that is the time to event. And what is the time to event? Because in logistic and linear regression also, because all these logistic, linear, and just a sec, let me first focus on the yes. So the logistic, and if you see the logistic and linear regression, it is basically you see the outcome. You don't see that in what time that outcome is there or the outcome has been achieved. But in Kaplan Meier or in life table or in Cox regression, you see the time to event, means that outcome has happened or not happened, and what was the time in achieving that outcome. And that event is known as the failure, which is also known as the this event or the failure is known as the hazard, and the people whom this event has not happened, who survived this event, is known as the survival. So we have learned two concepts. There is a survival distribution of the survival time, and then there is a hazard rate. And we have seen that the survival is a probability, and we learned regarding the conditional probability, which we apply in the Kaplan-Meier survival analysis. We also call it as a product limit estimator method. So this probability ranges from 0 to 1. So all survival, if you see, we express it in from 0 to 1. But if you see the hazard rate, the term rate is there, because in the hazard, in denominator, there is a small delta t. That mathematical formula we are not showing, but just assume that this hazard, we always call it as a hazard rate, because there's a time component in it, and it's the instantaneous potential for experiencing that event in a very small time, that is the delta t. And the person who has survived this, whom this event has not happened, they are the survivor. And then we calculate the survival probability, and we calculate the cumulative survival probability. So we have seen the life table that there is a fixed interval, and we see how much in each gender. Like yesterday we saw in the male and female baby the survival probability of the cessation of the breastfeeding. So the advantage of this Kaplan-Meier is, in case of a life table, you need huge data, whereas in Kaplan-Meier, even if there's a small number of data, you can perform this analysis, and you have a detailed survival estimate. It is more accurate in handling censoring data, because it you have the exact survival time, whereas in life table, you have got a interval. And that's how, again, there are some assumptions in the Kaplan-Meier, and we explained or we talked regarding the conditional probability. So if you see the conditional probability, it is basically the probability if a person has survived for 1 year, what is the probability that he will survive for second year or the second month. So what is the condition here? Condition is if the person has survived for 1 year. So this Kaplan, this conditional probability is in context of the Kaplan-Meier survival analysis, which involves considering the probability of surviving beyond a certain time point. But the prerequisite is that person should be survived up till the previous time point. Like I gave this example, if the patient is diagnosed with certain type of cancer, and you have got the survival time of survival probability after 1 year, 2 year, and 3 year, that is the 80%, 60%, and 50%. That you get from the life table also, or from the that table which you see in the JAM movie. So what is the conditional probability? That means how that cumulative survival is calculated. So conditional probability, if my interest is like, I want to know the condition, this survival during the third year, if the person has survived till the second year. So it will be denoted as this term, as you can see here. This P, that is the probability of surviving in third year, given the patient has survived during the second year. So how do we express it? In the numerator, you have got the survival probability during the third year. So that is the 50%. And then in denominator, the person has survived during the second year. So that probability is 60%. So the conditional probability will be 0.83 or 83%. Similarly, we have expressed this. What is this? So the interpretation, if the patient has already survived for 2 years, the probability that they will survive through the third year is approximately 83%. And this is useful in understanding the chance of continued survival at each subsequent point. And then we have learned regarding this product, because this is a product of all conditional probability of subject surviving at least 1 month after the beginning of the study. And then P2 is the conditional probability of surviving the second month after having survived in the first month. So in Kaplan-Meier analysis, either you can have an overall time to event, like we have seen in the JAM movie. I'll demonstrate it today also. Or you can compare it across any categorical independent variable. This was one example of that cumulative survival, which we have shown that if you start with 6 patients, you are following him up and the event of interest is death. So if at 4 months, 1 patient died, so how many remained? So survival will be 4, remained will be 5. So 5 remained because 1 died out of total. So 5 by 6. So cumulative survival at time t will be 0.833. Now, again, the second patient, the person died at 1 month and there was a loss to follow-up. So this loss to follow-up or the sensor data, we deduct it from the denominator and we take the survival time. So this left will be 3 because there is 1 death and 1 censored. So how many remain? 3. So it will be 3 by 4 because remember I talked that we will this 1 censored cases which you are seeing here, this we deducted from the denominator. This one. So that's why it is 3 by 4. So 0.750. So now what will be your cumulative survival? So this is the conditional probability. So that's why this Kaplan-Meier is the product. So I will multiply this probability with this probability. So this is the, again, conditional probability of surviving after this 10 month, during this 10 month, having survived till this 4 month. Then again at 14 month, 1 patient died. So it will be 2 by 3 because 3 remain. This is simple. Again, you will multiply it with the previous one. So you can see this is the conditional probability, which we have learned, just that probability of surviving in a particular time if the patient has survived just previous year or previous month, whatever you are taking as a unit. And then 1 died at 24 months. So there's a loss to follow. And since there was nobody remained, so the survival probability is cumulative is 0. So we learned the feature of survival curve, that it is like it starts from 1, where initially everyone is there in your study. As time passes by, then gradually if you follow up till infinity, this graph will touch the 0. That means everyone will die. And in this Kaplan-Meier, you can compare the survival curve. You can compare the survival curve with different arms, like if you have got treatment arm A and treatment arm B. And if you want to see, like yesterday we were seeing the control of blood pressure. So you can see like control of blood pressure in how many people there was a blood pressure control. So you can have like 2 components. Again, you can study this across any risk factor like presence or absence of diabetes or hypertension, or across a gender. So in any study, like, you have the data set. So you in that data set, you can see, although that was not a intervention study, it was a follow-up study. So there's but this, if you are doing an intervention study, you should have like A, B, they are the treatment arm. This is the follow-up duration, and this is the event of interest, which is the 1 is the event happened and 0 is the sensor. So now you can subjectively compare this curve to look for any difference. And if you are doing this in the late part, then it is the log rank test which we use. If you are doing it in the early period, then Breslau or test can be used. And if you are doing in the middle part, then Taron-Ware test can be used. We have also learned regarding the median survival time. So it is the event time where the cumulative survival becomes 0.5 or 50%. So it is the cumulative survival. Remember this, which we have seen here in this. This is the cumulative survival. So when the cumulative survival becomes 0.5, so many times what happens that this will not exact 0.5 if you are not getting. There can be a possibility that you have to define it maybe just lesser than 50%, because exact 0.5 you may not get in the graph. So this is the median survival time. Then we have seen the assumptions. So it can accommodate the missing data. This we have seen. Censoring. So I'll just now I'll go with the assumptions. So assumptions, if I have to again explain it, so you all know that here every event you have to define whether that is a censored event or that is a censored or that event has happened. And then time to that event is known as the survival time. And you should clearly, it should be clearly defined, and it should be precisely measured. So now another assumption is the independence of censoring an event. So this also is a study design issue, and you assume that there's no way to check this, but you assume that the censoring, the people who were lost to follow-up in your case, they were not due to the exposure, or they were not due to a experience of the event which you are studying. Let's say if you are studying in this example, like article which we have shared, cessation of breastfeeding, exclusive breastfeeding. So there were like 15% of the mother and child pair who were lost to follow-up, or study ended before they did not have any outcome. So then we will assume that they were not withdrawn, or they were not lost to follow. It was not due to the cessation of breastfeeding. So they have not experienced the event. So that we mean by the independence of the censoring and the event. And then we have seen that left censoring should be avoided. This is again a study design issue. We have studied regarding this left censoring. What is this left censoring? It happens when between the time T0 and the first follow-up time, if the exact survival time is not known, because that's how we define censoring. When the exact survival time is not known. So in case of a left censoring, what happens? Your observed survival time, that is always more than the true survival time, because when the patient reported to you, that event has happened. So the true survival time will be less than the observed survival time. And then we learned regarding the secular trend. So this secular trend is also known as the if the study in your period, if you are studying it for 5 years, there can be some changes in the screening process or in the treatment modality. And that has changed the survival probability of the individual who have joined after that event of the treatment. We'll see that with few examples. And then a similar amount and pattern of censorship per group. This we'll check with Jamovi, which I could not. In SPSS, it is very easy, but in Jamovi, we also will show how to do that. So secular trend, again, I said that secular trend means like if this long-term patterns or changes in the survival data over the time. If the study is for 10 years, there will be other advancement in the treatment or in the follow-up period or for the screening diagnosis that is there. So if the span of the study for many years, every individual have got a varied start time because participants are entering at a different time point in your study, and there can be some challenges like that. Like in this case, you can see if you are studying a 500 skin cancer patients and the event of interest is the death, and recruitment period, you are recruiting it over several months, each with their own diagnosis date. And in the meantime, if some new treatment has come up or some new diagnostic criteria for this diagnosis of skin cancer has come. So if there is some new diagnostic criteria, definitely it will reduce the left censoring. And if the treatment is there, better treatment, then it will increase the right censoring. Why? Because the person will not die. So it will increase the right censoring. Due to the improved treatment over time, more participants survive longer, delaying the occurrence of event, that is the death. And similarly, if there is an early diagnosis, so the person will be detected early. So there will be reduced left censoring. So how to manage that secular trend? The investigator should be aware of those secular trends, and a separate analysis can be performed before that secular, like invent of either the screening procedure, which reduces the left censoring, or the treatment modality, which increases the right censoring. So two separate type of analysis should be performed. So now I'll show this demonstration of the pattern of censorship. So yesterday we learned regarding this. So this is the data set. Let me delete everything, all, and remove. So now I'll come to this. So I have to check for the pattern and the this amount of censorship. So first I'll perform a descriptive analysis. So if you see the analysis, go to exploration. Yesterday also we saw that. Click this descriptive. Here you can see this event. So this event is the variable here, and if I have to see like across the gender, and if I want a percentage table, then I can see like frequency is this one. Their total censored event is the 30, like 15 in male and 15 in female, 8%. So I can say that the percentage of the censoring was equal in both. So this is regarding the amount of censorship. You can take any other event. So this should be the one of the criteria. Like if you take the education. So if you take education, you will see that this higher or lower, this pattern is same. If you are taking the marital status, then if you see it is 8 and 7%. So almost the amount of censoring is same in these two groups. Because of course you will see this censoring, this should be same, otherwise there will not be comparable, because there will be some under or overestimation of the survival rate if there is too much of difference between the two groups, the censored proportion between the two groups, and that group can be whatever you want to examine. Like in this case, if you are examining, yesterday we did with the gender, so you will check with the gender. So across any categorical variable, if you are seeing the survival probability, then you have to check for the amount of censorship using this descriptive. Is this okay for you people? One person can say yes or no amount.
Yes, ma'am.
Okay, thank you. Then regarding the pattern of censoring. So pattern, what do you mean by pattern? Pattern means like if your study is for 5 years. So in each, like every time you can see that there should be like same time point in both the group, there should be censoring. Like there should not be many censoring in the later part in one group and some censoring in the early group. And for that, we plot a scatter plot. So I'll show you how to plot a scatter plot. For scatter plot, you have to use an option which is known as the filter, because I have to do the scatter plot for only censored cases. So for using filter, you can see here, there is a option of filter and you can have this active or inactive. So what is the filter which I have to use? So I want to use, you can see there is a fx function or fx is there. So I will click on this fx and then I will click this event because I have to use this censored. So event, and I want to use this 0 because I want to select this censored cases. So in JAMOV, for equal to, you have to do the double equal to. And then if I press 0, it will select all censored cases. So you can see here that there is a filter and all these, if I see, that this is a filter, right? Let me see how many. So, okay, so marital status, if I see, that did not, okay, so I'll have to create a new one. So I can see that, and then you go to the analyze. But since in this case, if you see the variable, I have to see it across gender. So if you see gender, it is male and female is there. So I'll go to this analysis, and here in the this exploration, you will see that there is a scatter plot. So this, click on this scatter plot. So now in y-axis, you have to, there is a x-axis and there is a y-axis. So on the x-axis, you will definitely enter this time to event. And in the y-axis, you have to enter the gender. This event, sorry, because I have to see the pattern of censorship. And then, no, that is there for this, no, that is okay. Gender, let me check. This is the gender. So you can see the plot that this is time to event and this is the gender. So if you see the pattern of censoring, it is almost uniform in both the group. Like in initial part, so these two are comparable if you see the lines. So we can say that the pattern of censoring and the amount of censoring is almost same. Can you infer from this? I don't know whether I'm making myself clear or not. Have you understood this pattern of censoring? Amount was okay because you have to click the descriptive and see regarding the percentage of censoring in both the group. Here the pattern means whether the more or less censoring is there in early, middle or late part or not. But if you see these two, like gender baby, in both the cases you can see that censoring is almost during the entire span of the follow-up period, not concentrated across any specific period. Did you get it?
We don't have to see the curve. Like, we have to see the pattern means we have to see the curve, or we have to see that these sensor points are equally distributed.
Actually, this is a scatter plot. Normally, how do we make scatter plot? We make scatter plot when we have got two continuous variable. But here you will see that here I am making it with a categorical variable. So I have coded it as 1 and 2. So because I want to see whether the censoring in both these groups are, so you have to see these dots. Can you see these dots?
Yes.
Let me show you. Why the color is coming like that? Okay. So this you can see, this and this. Can you see
Yes, ma'am.
these two pattern? Because this 2 is for the female and 1 is for the male. And this is the time point, various time point. Because my study was for 180 days. So it is across that 180 days. So both these two, you can see that pattern, this was uniform. Like if you do any other thing, then you can see that in many cases, there will be like a concentrated censoring here. Or in this group, it might be only in the initial part. In the other group, it might be during the later part. So if the censoring is like concentrated and it is of different pattern in both the group, it will affect your survival probability, isn't it? Because if it is during the later part, then this survival time will be more. And if it is in the early part, here the survival time will be less. So that's why we call it that the pattern of censoring should be approximately similar in both the group, where you have to compare the Kaplan-Meier survival distribution.
Right, ma'am. Got it, ma'am. Thank you, ma'am.
Am I making myself clear to all other people who are here, like Tapobrata and Binu, Priya? Priya, so she said okay. Okay. So or should I explain it once again? Prashant? Binu said yes. Because Prashant asked me yesterday. Okay, so Prashant has written understood. So this was regarding the pattern of and the amount of censoring. Okay, thank you. Now we can go to that this survival. And in survival, I asked you people yesterday that use this survival analysis death watch for Kaplan-Meier. Because yesterday we downloaded the modules of the survival, that is the clinicopath module of the survival and the death watch. So this, if you want to perform only Kaplan-Meier, you don't want like Cox regression or life table, then better use this survival analysis Kaplan-Meier. So the exercise which we performed yesterday, if Kaplan-Meier, I have to perform this Kaplan-Meier analysis to estimate the survival curve and compare them for various levels of categorical variable like gender, marital status, skin-to-skin contact, and milk production perception. So I'll do it separately. So we can go back here. This is your, if you see, this is the time to event. This is the time elapsed. Event will be here. I have to select this termination of exclusive breastfeeding. And the groups are, I have to do it across gender. So this I have done. You have that median survival time here. Okay. Can anyone tell me why it is like this? What error did I do? Anyone?
Ma'am, the filter is on.
Yes, Bhavna is right. Remember, for showing you the pattern of censorship, I applied a filter here. By mistake, I did not off that filter. So in filter, in Jamo, there is a very beautiful option of this filter. You can create this filter. If you don't want it, you can like just make it inactive. Can you see there's a button here? Active. So once you have created it, no need to, in SPSS, you have to like again deselect it and again put it. But here it is very simple. You only have to inactivate it. So I have just inactivated this and now you will see that it has come. So these errors, you have to be careful and don't get panicked like why this result is like this. So you can see the median survival time. It is more in female, but if you see the value of log rank, I have not clicked this. These are the various tests. So I said that log rank is most commonly done. You can click that. And this is the risk table. And if you want this calculation of this over the graph, you can click this medians. It takes some time to get buffered. And then this graph will appear here. So you can see this is the risk number at risk set, which we discussed yesterday at various time points. And this is the median survival. And you can see the value of log rank. It is not significant because the P is 0.2. Again, I have to do with this other categorical variable you can check. There was education. So if you like enter education, you can see the value of log rank. So it was significant. And if you see the median survival time, so median survival time, lower education, it was higher. That means the cessation of breast feeding was exclusive breastfeeding was for more number of days. That was the 130 days in the lower socioeconomic, and it was less in the high, sorry, not socioeconomic, in the education. And this, which was significant. And this you can see that the survival curve, which is upper, that has got a better survival probability. So the lower one has got the better survival, and you can see the median survival time here also. It is more in case of the lower education. Then again, there was some skin-to-skin contact. So again, you can enter the skin-to-skin contact. So survival was more. Now, if you see this is again log rank is significant. And if you see the median survival time, although it was very, there was a difference of only 2 days, like 90 days in case of a no skin-to-skin contact and 92 days in case of a yes skin-to-skin contact. But if you see the value of this log rank, it was significant. And this was the curve. Now, so this is again, and then I think there was one milk production. So like this one. This creates echo. So this you can see. There are 4, and if you want to see the log rank, overall log rank was significant. And if there are more than 3 or more than 3 group, then you can perform this pairwise comparison. It will show you which 2 groups were significant, because this log rank gives you overall p-value or the significant. So now you can see this like comparison between the NF. It is just like ANOVA, which any one of you who have performed ANOVA, you see that if there are 3 or more than 3, then you perform the pairwise comparison. So it is performing like enough and little, between enough and moderate, enough and more than enough. And if you see the value of this p-value, so everything is significant except this 0.237, which is between the moderate and little, this one. So you can comment like these two were not significant. This one, between the little and moderate, and again between the little and more than enough. So between little and this thing, it was not more than enough, and moderate, it was not significant. And between moderate and more than enough also, it was not significant. So these 3 were not significant. Rest pairwise comparison was significant. So did you get it, Prashant and all other participants? Then we'll go to the breakout room. Let me check with the messages. Yes or no? Can you show me?
Okay.
Okay. Yes. So Naveen is there?
Yes, ma'am.
So please
Yes.
open. So we